Madam President.
The senator from Texas.
Madam President, today is the 20th day of the Schumer shutdown. And people around the country are beginning to feel the effects of the shutdown. For example, here, nearly all federal employees, from government agencies to those working here in the Senate chamber, will have missed their first paycheck. 1 out of every 6 Americans lives from paycheck to paycheck. It's not uncommon. This means that the shutdown is preventing those individuals from paying their basic expenses: food, shelter, clothing, utilities. Normally, Americans who aren't able to put food on the table for themselves and their families can fall back on government programs should they qualify. However, the U.S. Department of Agriculture recently sent a letter to the states, including Texas, announcing they will not be able to continue funding the Supplemental Nutrition Assistance Program, or SNAP, due to the lapse in congressional appropriations. According to federal law, food programs like SNAP and WIC, the Women and Infants and Children program, may continue to operate even during the shutdown as long as funds are available. But once those funds are dried up, it's simply not possible for them to continue providing benefits. The guidance from the U.S. Department of Agriculture directs states to pause those payments for the programs. This means that Texans who rely upon SNAP as a safety net to buy their groceries and feed their children will not have those benefits until this deranged shutdown comes to an end. During the negotiations on the One Big Beautiful Bill, the Working Families Tax Cut Act, I was happy to champion certain reforms to ensure that those benefits were targeted on the truly poor and vulnerable. Chief among those reforms were enhanced eligibility verification and work requirements for able-bodied adults, ensuring that those who can work do work in order to continue to receive benefits. Throughout those negotiations, Democrats accused Republicans of taking food from the mouths of the poor and needy. But of course, this is not what we did with the One Big Beautiful Bill at all. The reforms we implemented in the One Big Beautiful Bill ensured that these programs were financially secure for the long haul, so we can continue to provide those benefits to those who truly need them. But now, Senate Democrats have voted 9 times against a House-passed short-term funding bill that would immediately reopen the government. And now they are preventing these programs from operating at all. So what Democrats falsely accused Republicans of just a few weeks back, they themselves are doing by forcing these programs to end or to pause. Senate Democrats are literally taking food from the mouths of hungry children. These programs are designed to ensure that those who have come across hard times are able to get the food they need for themselves and their children. And now Senate Democrats are the reason why Texans, particularly those in need, are unable to do so now. But that's not all. This shutdown is creating a particularly severe consequence for rural health clinics across America, many of which are unable to continue their full telehealth services to patients during the shutdown. One of my constituents wrote in to say that not being able to offer telehealth has put us at a huge disadvantage with patients. There are many who will seek care elsewhere and some who won't seek care at all. One of the only good things to come out of COVID-19 is the expansion of access to telehealth. And now, because of the shutdown, Democrats are denying patients that need that access, denying them that access altogether. This constituent that I mentioned a moment ago that I quoted described an immunocompromised Texans who were discharged from the hospital who require follow-up appointments, but the risk of infection from other patients in the waiting room makes it actually too risky for them to appear in the hospital in person. Telehealth appointments are a good solution for such patients, but due to the shutdown, they're simply not available. For other patients who live in rural areas who are homebound from severe illnesses, telehealth can be the difference between receiving care and receiving no care. My office recently heard a devastating story about one such patient in a Texas hospital who has stage 4 cancer and who has missed his last 2 appointments. This individual lives 45 minutes from care in the Panhandle in North Texas and is a model patient for telehealth, but thanks to Senate Democrats, that is no longer an option for him. Madam President, imagine the devastation of having a loved one suffer from late-stage cancer and knowing that this person is missing out of access to health care because of the Schumer shutdown. It's simply indefensible. And these are real people, real patients, and real Texans. Now, this government shutdown may not affect the Democratic leader or some members of Congress who are independently well off. But for those people who depend on these services and who live paycheck to paycheck, it has real-world consequences. This government shutdown is, in other words, not a game. And yet Senate Democrats refuse to treat this matter with the seriousness that it deserves. It's been quoted many times now, but the minority leader has said to the news media, quote, "Every day gets better for us," close quote. Well, clearly he's not talking about the individuals I've been referring to. I'd like to see the minority leader, the senator from New York, say those words to the cancer patient who's unable to get access to treatment or to telehealth services, or the family who relies on food stamps who's unable to put groceries on the table to feed their family, or to the Capitol police officers who provide security in this very building who are not receiving a paycheck. I can guarantee the Democratic leader that those people will not say to him that every day is getting better. The people who we work for, our constituents, the folks who sent us here, are growing more apprehensive by the day, not knowing when this will end. And while many people simply don't feel the effect of a government shutdown, very real people, like the ones I mentioned, definitely feel this shutdown. And it doesn't have to be this way. All we have to do, as we've said time and time again, is pass the short-term funding bill that will only take us to November the 21st. It's already passed the House of Representatives. 3 Democrats in the Senate have joined Republicans in voting to reopen the government. Are there not 5 more Democrats willing to buck the heartless display of the minority leader and put the American people first rather than their political party and their political aspirations? Well, I hope that the cries of those children who are without food and homebound cancer patients without access to health care will carry more weight with Senate Democrats than the ruthless partisanship coming from the Democratic leader. This is called the Schumer shutdown for a reason, because there is, in fact, one person ultimately responsible in this chamber. The House has passed the bill. All Republicans are willing to support it, and we just need a few more Senate Democrats to put an end to this foolishness. Madam President, I yield the floor.
The clerk